can involve commodification. What commodification is, it is turning the body into something for sale. In ways that you could do that could be with being a surrogate, donating your sperm. We even have organs that are dealt with in the black market. But a way to avoid that could be with donating organs. And it could just be organs like hearts, kidneys, lungs. But if you want to donate tissues too, you got the cornea, the veins, the tendons, and all that stuff. And the great thing about being an organ donor is it can start from all ages, from being a newborn all the way to a senior citizen. All right, the great thing about being an organ donor is you could actually call yourself a hero. You're saving someone's life. There are currently about 100,000 men and women and children in the United States who are currently waiting for an organ transplant. And a registered organ donor can help save many lives. About 18 people die on an average day due to the non-availability of organs, and it enhances the lives of 50 others when you are an organ donor, so that's awesome. And the great thing about being an organ donor is that the person that you're donating to is very grateful.
Through organ donation, the organ recipient is able to return to a normal lifestyle while saving costly health treatments that they may no longer need. Because of organ donors, thousands of people are able to live fuller and more productive lives. Since every 10 minutes, another name is added to the National Organ Transplant waiting list. The receiver will feel highly blessed and forever thankful to the donor, as many would not have otherwise survived their illness, giving them a new chance at life. Up to 95% of eye donation transplant recipients can actually see again.
And many people opt to donate their organs or even their entire bodies towards medical research, performing experiments on donated organs, tissues, and body greatly benefits medical scientists to help find treatment and cures. And for many medical conditions like diabetes, cancers, because believe me, cancer is there like all the time. They're finding a new cancer all the time for something. And when you donate your body, there you go. You're helping a medical student or just anything like a doctor figure out more about cancer and things like that. This can further assist medical practitioners into developing various cures that help save lives in the future. And many people worry that if they are registered as an organ donor, medical doctors, surgeons will not try their best to save their life if they were ever to be involved in a medical emergency. But however, this is not true because the organ donation staff is completely different from who is going to be operating on you. Surgeons do not consider any life more important than another and will do their best to save the person in front of them, organ donor or not. Donor or family does not fund the cost, so the organ donor or their family will not have to fund the cost of the surgery due to remove the organ. Instead, the cost related to the donation will fall into the organ recipient or the transplant program. Thus, there is no cost to the donor or their family for charges related to the donation.
Part of you will live on. Organ donors can see donating organs is essential for goodwill and self-gratitude through helping another in need and or having a part of themselves to continue living on in goodwill. Although others may feel otherwise, it is an advantage for those that find gratitude in the essential of having a part of their physical self to to continue living on. Many donor families have also found comfort in knowing that they and their loved ones have helped life go on for someone else.
So there is a medical model involved with health and medicine. The medical model of disability is a socio-political model by which illness or disability, being the result of a physical condition intrinsic to the individual, which is it's part of the individual's own body, may reduce the individual's quality of life and cause clear disadvantages to the individual. The medical model tends to believe that curing or at least managing illnesses or disabilities mostly or completely revolves around identifying the illness or disability from an in-depth clinical perspective. In the sense of like scientific understanding undertaken by trained healthcare providers, just understanding it and learning to control and or alter its course. By extension, the medical model also believes that a compassionate or just social or just society invests resources in healthcare and related services in an attempt to cure disabilities medically, to expand functionally and or improve functioning and to allow disabled persons a more normal life. The medical profession's responsibility and potential in this area is seen as central.
It is illustrated by the World Health Organization, or WHO. The definition, which significantly were devised by doctors. You have impairment, disability, and handicapped, and an impairment is any loss or abnormality of physical or anatomical structure or functions. And then a disability is any restriction or lack of ability resulting from an impairment to perform an activity in the manner or within the range considered normal for a human being. And then for a handicap, any disadvantage for a given individual resulting from impairment or disability that limits to or prevents the fulfillment of a role that is normal for that individual. A disability is a deficiency or abnormality of the body. Having a disability in other people's eyes is seen as negative or to be put down in a sense. Okay, let's retry that. People say that the disability resides in the individual themselves, saying that it's their fault for having the disability because they were born with it. They actually don't have a choice to choose if they have ADD, to choose if they have ADHD, to choose if they have an extra chromosome, meaning they have Down syndrome, or to be born with cancer, something that just doesn't help them work. The remedy for disability-related problems is cure or normalization for the individual to more normalize them, make them more of a adapted human being, to be treated without their abnormality, to make them as normal as possible. What a disabled person cannot do instead of what a disabled person can do is what the medical model is based on, seeing the bad side versus the good side. The model is also called an individual model because of oneself. And medical science, in keeping many disabled people alive and reducing their pain and discomfort, but it is to argue that disabled people should not be reduced to just their impairments. We need to treat them just like everyone else. The medical model sees the disabled person as the main problem for them having this disability. If it's not possible, they should be shut away in isolation. The impairment is focused on rather than the needs of the individual themselves. Um, Disabled people's lives are handed over to science professionals, and their decisions affect where disabled people go to school, what support they can get, where they should be able to live, what benefits they are entitled to, whether they can or cannot work, even at times whether they are born at all, or allowed to have children themselves. In school, for instance, special education needs are considered the problem of the individual, who is seen as different, faculty, and needing to be assessed and made as normal as possible.
So, life expectancy of American men and women is less than other industrialized nations. Nearly 46 million Americans are uninsured. In the United States, spends more on healthcare than other industrialized nations, and those countries provide healthcare insurance to all their citizens. And the chronically ill U.S. Patients have the most negative access, coordination, and safety experiences compared to chronically ill patients of, let's say, Australia, Canada, France, Germany, Netherlands, New Zealand, and the United Kingdom. The United States has a higher rate of medical mistakes, medication errors, or lab errors than Canada, Australia, New Zealand, all those countries that I said. And the Institute of Medicine, IOM, estimates that 44,000 to 99,000 patients die in hospitals each year due to medical error. And the Institute of Medicine estimates there are at least 1.5 million preventable adverse drug events in the U.S. every year. It is estimated to unnecessary care of overtreatment, which kills 30,000 Americans a year, the equivalent of a 747 airliner crashing and killing everyone aboard once a week. And the U.S. ranks last out of 16 industrialized countries on a measure of morality. Amenable to medical care, which is the death that might have been prevented with timely and effective care. And premature death rates at 68% higher than the best performing countries. Premature death rates are at 68% higher. I just read that too. Okay, I'm just going to skip to. While the rate declined over time for the United Kingdom, while the rates declined over the time for the United Kingdom, Germany, and France, the U.S. rate still lags behind. The U.S. patients reporting that medical records and test results are not available during a visit or that tests are duplicated unnecessarily was 30% higher than patients reporting in Australia, Canada, France, Germany, the Netherlands, and all the countries that I stated before. Reducing readmissions and hospitalization for preventable conditions alone could save the medical care program at least 12 billion
per year.
Yeah. And Americans spend more per capita on health than all other countries in the U.S. Americans spend more per capita on healthcare than all countries in the world. Americans have the highest infant mortality rate among 23 other individualized nations. And 50% of Americans don't get the recommended preventative care and screening tests that science recommends. 82% of Americans don't get the recommended health counseling and education for their conditions.
Medical errors are the 8th leading cause of the death in the United States. Even as healthcare spendings per capita have increased in the United States over the last 3 decades, the nation has fallen behind 12 other wealthy nations in the last 15 years survival for men and women at ages 45 to 65. By 2005, 15-year survival rate for 45-year-old white women in the United States were lower than in all compression countries. These rates have not even surpassed 1975 survival rates for Swiss, Swedish, Dutch, or Japanese women. The U.S. white man ages 45 to 65 experienced declines in their ranking in 15 years survival rates among the compression countries, but they were not as dramatic as the decline in ranking for women.